Hello everyone, welcome back to our channel. Did you know that certain widely used medications can impair your memory and cognitive health? Have you ever considered that the medication you're taking might be affecting your cognitive abilities? Identifying and avoiding these drugs can potentially enhance your quality of life. Recent findings indicate that memory loss isn't an inevitable aspect of aging. Some medications, if not used under careful supervision, can have profound negative effects on the brain. Why do drugs that seem harmless lead to such serious consequences? And how can we safeguard our brain health while managing other medical conditions? Protecting our brain health and preventing dementia requires a comprehensive approach, including promoting a healthy lifestyle, controlling chronic diseases, and employing medical interventions as needed. Ongoing research aims to discover new treatments and interventions that can slow or prevent the progression of dementia. The realization that cognitive decline is not an inevitable part of aging can encourage proactive steps to maintain brain health throughout life. Many commonly used medications can negatively affect memory and cognitive function, a fact that is often unknown to patients. While these medications are effective in treating various conditions, they can have serious side effects, including the deterioration of memory and other cognitive functions. Here are 8 medications that can harm your memory and brain health. 1. Antiepileptic. Antiepileptic medications such as phenytoin, carbamazepine, and valproate are not only crucial for treating epilepsy and seizure disorders but also play a vital role in stabilizing neural membranes and preventing abnormal electrical discharges in the brain. However, many people are unaware that prolonged use of these drugs can pose potential risks to brain health, especially in the elderly. Specifically, a study involving about 6,000 people has shown that antiepileptic drugs can lead to cognitive decline and increase the risk of dementia. This is primarily due to the medication's impact on the activity of neurotransmitters, which are essential for regulating cognitive functions such as learning and memory. Moreover, these drugs can negatively affect protein synthesis and the function of neurons, causing irreversible damage and resulting in cognitive impairment. A study published in the journal Neurology found that individuals who used phenytoin for extended periods had a significantly higher risk of experiencing memory problems compared to those who did not use the drug. This study indicated that phenytoin's effects could reduce blood flow to the brain and impair neuronal function, leading to cognitive decline. Therefore, the use of antiepileptic drugs needs to be carefully managed by healthcare professionals. Patients, especially the elderly, should regularly discuss the dosage and duration of these medications with their doctors, as well as consider alternative or supplementary treatments if available. Coupled with a healthy lifestyle, including a balanced diet, regular exercise, and engaging in mental activities. These measures can help mitigate the risk of cognitive decline from medication and protect overall brain health comprehensively. If you found this video helpful, please like and subscribe for more important health information. 2. Z-drugs. Z-drugs, such as zolpidem and zopiclone, are commonly prescribed to treat insomnia as they help relax the body and promote deeper sleep. Although effective, these medications can have significant adverse effects on the brain, especially with prolonged use. Specifically, Z-drugs impact memory by enhancing the activity of GABA, an inhibitory neurotransmitter that calms the nervous system. While this can be beneficial for reducing stress and improving sleep, increased GABA activity can also impair the brain's ability to store and process new information, leading to short-term memory loss. Notably, zolpidem and zopiclone can disrupt the process of memory consolidation that occurs during sleep, which is essential for retaining information and enhancing learning abilities. A study published in the Journal of Clinical Sleep Medicine found that long-term users of zolpidem had a higher risk of memory issues, such as difficulty recalling events and information learned, leading to a general decline in cognitive function. Furthermore, these short-term memory loss symptoms not only decrease daily life quality but can also be early warning signs of more severe issues, such as dementia. This is particularly concerning as these symptoms can be subtle and easily confused with other cognitive problems, especially in older adults. Therefore, close monitoring by healthcare professionals is crucial when prescribing and using Z-drugs, ensuring that patients are thoroughly assessed for any adverse effects on memory and cognition. Users, particularly the elderly, should discuss alternative or supplementary treatment options with their doctors, such as cognitive behavioral therapy for insomnia, lifestyle changes, and relaxation techniques to improve sleep without medication. These approaches can help mitigate the potential risks to brain health while enhancing overall quality of life. 3. Beta blockers. Beta blockers, such as propranolol and atenolol, are commonly prescribed to manage high blood pressure and other cardiovascular issues because they can slow the heart rate and reduce the force of heart contractions. While they are highly effective in managing these conditions, few people know that these drugs can have potential side effects on cognitive function, particularly in older adults. Specifically, beta blockers work by blocking the effects of adrenaline and noradrenaline, stress hormones that not only impact the cardiovascular system but also play a critical role in memory formation and retrieval. When the levels of these hormones are reduced, the brain may struggle to store and process new information, leading to memory impairment. Notably, a study published in the Journal of Hypertension found that individuals taking beta blockers scored lower on memory tests, indicating a significant decline in cognitive function. Furthermore, beta blockers can affect the blood-brain barrier, restricting the supply of oxygen and nutrients to the brain, which are essential for maintaining cognitive health. This deficiency can lead to decreased brain function and an increased risk of developing dementia, especially in older adults or those with a history of health issues. Beyond this, the use of beta blockers has also been associated with symptoms of depression, another risk factor for memory loss, as depression can impair concentration and overall mental function. Given these risks, the use of beta blockers should be closely monitored by healthcare professionals. This is particularly important for older adults, who are at a higher risk of cognitive decline. Patients should regularly discuss with their doctors about alternative or supplementary treatment options, as well as non-pharmacological measures to control blood pressure, such as dietary changes, regular exercise, and relaxation techniques to manage stress. 4. Fibrates. Fibrates, such as gemfibrozil and fenofibrate, are commonly prescribed to lower blood cholesterol levels, particularly triglycerides, and increase high-density lipoprotein, HDL, cholesterol. However, while beneficial for cardiovascular health, recent studies have suggested that long-term use of fibrates may be linked to cognitive decline. This occurs because fibrates work by activating PARs, which play a crucial role in lipid metabolism but also participate in brain functions, including regulating inflammatory responses and maintaining neuronal health. Consequently, this activation can alter the lipid composition of cell membranes, including in the brain, affecting the fluidity and function of neurons. Furthermore, fibrates may negatively impact the blood-brain barrier, causing changes in the brain's environment, which increases the risk of neurodegenerative damage. Another concerning issue is that fibrates may reduce the synthesis of coenzyme Q10, CoQ10, a vital component in cellular energy production and antioxidant defense, especially important for the brain. A deficiency in CoQ10 can lead to oxidative stress and damage to neuronal cells, exacerbating memory problems. Therefore, the use of fibrates should be closely monitored, especially in older adults. This includes regular cognitive assessments and discussions with healthcare providers about alternative therapies or lifestyle changes to manage cholesterol levels. Measures such as a balanced diet, regular exercise, and mentally stimulating activities can help protect cognitive health and improve overall quality of life. 5. Muscle relaxants. Muscle relaxants are a group of medications commonly used to reduce muscle spasms in conditions such as muscle injuries, spinal disorders, and neurological issues. Two commonly used drugs in this category are baclofen and diazepam. Although effective in treating muscle spasms, these medications can have serious side effects on memory and cognitive function. Baclofen works by stimulating GABA B receptors in the central nervous system to reduce muscle spasms. However, it can cause memory loss, difficulty concentrating, and impaired learning abilities. Some studies have indicated that high doses or long-term use of baclofen may increase the risk of cognitive decline, especially in older adults. Similarly, diazepam, a type of benzodiazepine, enhances the effect of GABA, a neurotransmitter with calming effects. However, diazepam can lead to memory problems, particularly short-term memory loss, due to its sedative effects and the reduction of concentration ability. Research has shown that long-term use of benzodiazepines, especially at high doses, is associated with an increased risk of developing Alzheimer's disease and other forms of dementia. This may be due to the impact of diazepam on sleep quality and the brain's ability to clean up harmful proteins like beta amyloid, a key factor in Alzheimer's disease. Thus, the prolonged use of muscle relaxants such as baclofen and diazepam can lead to an increased risk of memory problems and dementia, including Alzheimer's disease. This underscores the importance of using these medications under medical supervision, particularly in older adults or those at high risk of cognitive issues. Therefore, patients should be regularly monitored and alternative treatment options considered when possible to minimize these risks. 6. Antihistamines. First-generation antihistamines, such as chlorpheniramine and diphenhydramine, are widely used to relieve allergy and cold symptoms. While effective in immediately alleviating symptoms like congestion and itching, these medications have a dark side. Their long-term adverse effects on memory and cognitive function. These antihistamines work by blocking the action of histamine, a substance in the body that causes allergy symptoms. However, they also have an anticholinergic effect, meaning they block acetylcholine, a crucial neurotransmitter for memory and learning. Prolonged use of these medications can therefore lead to significant cognitive problems. Studies have shown that first-generation antihistamines are associated with an increased risk of dementia. Recent research reviewed 138 studies on the adverse effects of these medications and found a strong association between prolonged use and cognitive disorders. Patients who used these medications regularly reported memory problems and difficulty concentrating, even after stopping use. Safer alternatives, such as second-generation antihistamines, for example, loratadine and cetirizine, have fewer adverse effects and are not associated with cognitive problems. These medications are preferred for long-term allergy treatment, offering effective symptom relief without the same risks to brain health. Besides cognitive risks, first-generation antihistamines can cause other side effects, such as drowsiness, dry mouth, and blurred vision. These effects can significantly impact the quality of life, especially in the elderly, who are more susceptible to adverse effects of these medications. To minimize risks, it is important that patients consult their doctors before using first-generation antihistamines for long periods. Considering safer alternatives and adopting other allergy management measures, such as environmental and dietary changes, can help reduce the need for these medications and protect cognitive health. 7. Migraine medications. Ergotamine, commonly used to treat migraine headaches, works by constricting blood vessels in the brain, providing quick relief. However, a concerning aspect is that long-term use of ergotamine can lead to serious health issues, particularly related to cognitive functions. Specifically, this medication can cause memory impairment, making it difficult for patients to concentrate and reducing their ability to learn. This may be due to prolonged constriction of brain blood vessels, which affects the supply of blood and oxygen to the brain. Furthermore, some studies have indicated that long-term use of ergotamine increases the risk of developing cognitive disorders, including dementia, with these risks depending on dosage, frequency of use, and the patient's underlying health conditions. Additionally, long-term use of ergotamine is associated with other neurological conditions such as stroke, especially in individuals with a history of cardiovascular disease, due to the drug's ability to constrict blood vessels. Another serious condition is vasospasm syndrome, where prolonged constriction of blood vessels leads to pain and organ damage. Therefore, the use of ergotamine should be closely monitored by a physician, and patients are advised against prolonged self-medication. Moreover, patients should consider other treatment options with fewer risks, such as non-steroidal anti-inflammatory drugs, NSAIDs, or preventive therapies. Understanding the impact of ergotamine on memory and brain health is crucial for making safe and effective treatment decisions, protecting cognitive health, and ensuring a better quality of life for patients. 8. Antipsychotic medications. Haloperidol and risperidone are two commonly used antipsychotic medications for treating mental disorders such as schizophrenia and bipolar disorder. However, the use of these drugs can significantly impact a patient's memory and cognition. Specifically, they can cause memory impairment, making it difficult for patients to recall important information and events. Furthermore, these medications can affect the ability to learn and process new information due to their effects on neurotransmitters in the brain. This not only reduces the quality of life but also increases the risk of developing serious brain-related conditions, including Alzheimer's disease. Some studies have indicated that the use of antipsychotic drugs can increase the risk of developing Alzheimer's disease and other neurodegenerative diseases. The reason is that these drugs can disrupt the balance of neurotransmitters, leading to brain cell damage and the formation of amyloid plaques and neurofibrillary tangles, which are characteristic of Alzheimer's. Moreover, the long-term use of haloperidol and risperidone can lead to other cognitive disorders, impairing the ability to think, reason, and solve problems. Therefore, the use of antipsychotic medications should be closely monitored by a physician to ensure appropriate dosage and duration, minimizing negative impacts on memory and cognition. Additionally, patients should discuss with their doctors about alternative treatments with fewer risks or incorporate non-drug therapies, such as psychological therapy or other supportive psychological methods. Understanding the impact of antipsychotic drugs like haloperidol and risperidone on memory and brain health is crucial for making safe and effective treatment decisions, protecting cognitive health, and improving the quality of life for patients. Self-medication and long-term use of certain medications can cause significant side effects on memory and cognitive function. This article highlights how common medications can harm the brain over the long term. It is important that patients always consult with their doctors before starting or continuing any medication. Informed discussions about risks and benefits, as well as exploring safer alternatives, are essential to protecting cognitive health and overall well-being. Don't forget to subscribe to our channel to update the latest health information. Wishing you health, wealth, and happiness. Thanks for watching and see you in the next video.